I think it's really important to talk to young students and try to, inspire them and help them realize the difficulties they're going to face and how to get over them and how to, have some perseverance. And so I love doing it. And I've talked to lots of high school classes or individual schools, but, this is an opportunity to reach a lot more people all at once. So that's really special. Well, I think in some ways there are maybe some aspects that are harder because, the research budget is not expanding like it used to be. But on the other hand, there's so many interesting questions. The technology is developing so quickly. I think there are so many opportunities to get involved and make contributions. Well, I've migrated from project to project over the years. I think a really good thing to do, just to sort of keep things fresh, is you maybe work on something for 5 or 10 years, and then step back, look around. There are lots of other things out there, right? You can become, it only takes a year or two to become an expert in a new field. So there's no need to just keep working on the same thing your whole life. It's much more interesting to move around and explore different areas. Forums like this or it can be anything from being in groups of people in their school, or if they end up working in a lab, you're already in a little miniature community of people with a common interest. That really helps a lot. Yeah, it shows we're just normal people. We're just people who've been successful in one way or another, and yeah, it's nothing magical. I think people who are smart and work hard and like to think can do it. The thing that makes it hard is that there's a kind of a yin-yang thing between aging and cancer, right? So we can't just turn it on everywhere. That'd be bad. We know that. But if we could learn how to turn on the enzyme at the right level, at the right place, at the right time, you might be able to have a huge impact on a lot of age-related diseases. So I think that's the hope for the future, definitely. The approach that we're taking is, how can you actually build cells from chemicals, right? It happened on the early Earth, right? So there has to be a way. Now, so that has definitely not been done, not by us, not by anyone else. What you're going to hear about, maybe what you're thinking about, is Craig Venter's work, right? So that is it's an incredible breakthrough to be able to replace the DNA of a cell with new DNA. And in principle, now we can go and design new forms of life. It's not the same, right? Because you're not creating a cell from scratch. You're altering it, which is really important and has probably a lot more practical applications than what we're doing. But I think it's fundamentally different. On the side of, could this be dangerous? Could we be creating problems? I don't think so, because what we're making are such simple, primitive systems. They're sort of barely, if we succeed, they'll be barely getting by. And we want to use that to study the origins of evolution. That's the real goal, right? So these are not going to be, they're much simpler than any bacteria or virus that exists today, right? So those are where the real problems are. And in re-engineering cells that can live out in the wild, there I think we have to be pretty careful about what we're doing. The place where I think the practical applications are, and along with that maybe some of the dangers, are in manipulating the genomes of organisms that can escape from the lab, and they do, and they live out in the wild. And if you know enough about it, maybe it's innocuous. But we have to understand and be careful. For a while, we did talk to people, ethicists and so on a lot. Howard Hughes Medical Institute had a program in that. But I think eventually they realized that what we're doing is really just chemistry. And where the issues are is with sort of large-scale genetic engineering. And the real issues are in terms of people, right? And both intentional and, in a sense, inadvertent genetic engineering, right? As we can maybe call out bad mutations, what are the unforeseen consequences of, those are hard questions that we really need to think about. Well, I think probably a lot of young kids are trying to decide, what do I do next, right? there's so many choices. When you're young, you don't really know what the opportunities are that are out there. You don't really know what you can do personally. So I think it's really great to hear people from different branches of science and medicine, just talk about their path. And that's really a great educational experience. So I think that's a really terrific thing.